And welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mele talking about a bunch of different topics. And we've got otoplasty next on the docket.
Yay.
Otoplasty, for those who do not know, what is otoplasty?
Oto refers to the ear, and plasty means to change. So we're changing the
the
shape
ears.
of the ear. Yeah.
Who needs otoplasty?
Most common otoplasties are for prominent ears, or ears that stick out.
Okay.
So we're basically bringing them back or pinning the ears. But there are other types. There's sometimes the ear folds are in different shapes or different positions. There's actually something called Spock ear, which is a Stahl's ear, where there's an extra fold that goes backwards that will smooth out and round out the top of the ear. There's something called lop ear, where the top of the ear is constricted and tight and folds over, and we try and expand it and make it round.
Oh.
But the most common is just pushing them back.
And is that painful? How does that work? How do you do that?
So it's done through an incision behind the ear.
Okay.
And the ear gets its shape from the cartilage that's inside of it.
Oh,
so from the back of the ear, we'll put little stitches in the cartilage to form the normal folds to fold the ear back towards the head. Sometimes the concha, which is the bell that catches sound, is just big.
Like the shell.
Yeah, so we'll remove a little bit of that, and that way, because sometimes it acts like a kickstand with the ear fold back.
Okay.
We'll take a little bit out and let it come back.
Now, is that local or is that general anesthesia?
Depends on the age. Some people are like 5 years old when they're getting their ears fixed.
Oh, that's true. You can do it
Anesthesia
early.
is really good in that situation because they're more cooperative.
Yeah.
For adults, often it can be done under local anesthesia, but general anesthesia is also available.
And what about downtime? If you have long hair?
Downtime, the head's wrapped up for a week, so you got to have a week to
you're wrapped up for a week. I gotcha.
And then at night, I'll often have them wear like a sweatband just to keep the ears in, so we don't lay on it and fold them the wrong way.
Wow.
But during the day, usually you can have it off by a week.
Oh, that's not too bad.
No, it's a little swollen, but they look normal.
Let's go to our pictures, the best part, before and after photos. Here we go. Oh,
so here we go. So these are sticky out ears.
That is
and
very prominent.
Just bring them back.
Wow.
And I've got one coming up where you can see the incision a week out, and it's already hard to see.
Because you can't really see the incision here.
No.
You can't really tell.
No, and the pictures look even better from the front, but try to keep people's anonymity. So. But you can actually see the ears a little better together from behind.
Yeah, absolutely.
But in this case, totally normal ear, normal shape. It's just the upper part of the ear did not fold back during development. I just fold it back, and it looks totally normal.
Look at this picture.
So
okay.
Same idea here.
Okay, yeah.
So he has a left ear that sticks out.
Yeah.
Right ear he was pretty happy with.
Okay. So you just
sometimes we just do one side. So in this case, just did the left ear. So there's an incision running right up and down the back of that left ear. He's got really short hair, but the incision hides pretty darn quickly.
You know, for a man to actually go in for something like that, that has to be pretty bad from the,
No, I've had patients who have really long hair. They get a promotion. They're told they have to cut their hair.
Oh,
and they won't want their promotion because they don't want to have their ears sticking out.
Going to see Dr. Mele. All right, number 3.
So here, both ears sticking out, especially the upper pole.
Got a lot of men doing it.
Yeah, men and women both. But the upper poles were really out wide. The lower part, the earlobe, everything else is fine. So it's a matter of just bringing that upper pole in.
So that's basically just cosmetic. If it's happening like that, you can't hear differently. It's just basically cosmetic, right?
No, the ear's working.
The ear's working just fine.
There are some ear deformities that are associated with hearing problems, but they're more like microtia, little ears or ears that don't develop.
Gotcha.
Usually by the time this last fold's happening, everything inside is done.
Oh, okay. Everything's... All right,
so
next
the inside works. Same idea here. So this is shortly after surgery. The ear looks a little bit swollen. The incision's right there.
It's great. You can't see the incisions. He's got short hair, obviously. You really can't see.
Well, sometimes people do cut their hair afterwards because they...
but
in his case, he was pretty short to start with.
Last picture. Are they excited? They want to cut their hair to show the ears?
Well, sometimes they want to cut their hair and they just, their ears are already sticking out, so they use their longer hair to cover it up. But same idea here. So, both sides have been brought in. Reduce the concha a little bit on this time because the bell of the ear was big, and the folding of the upper part of the ear to bring it in.
Is there any pain after the surgery?
It's really variable. I have some patients that have no pain and some where it just feels like someone's pinching their ear hard for 3 or 4 days.
Okay.
But usually the first couple of days are the hardest, and then after time goes on, a little bit of pain medicine helps. They do well.
Has otoplasty changed in the past? Because I know it used to be a pretty painful surgery, but the way you do it, has that changed?
I think part of the way to get less pain is just being really meticulous during the surgery and trying to decrease any chance of bleeding. Because bleeding with this is not where you bleed to death or need a transfusion. But if you get a little blood under the skin, it makes a bump. And you get a cauliflower ear. And it also hurts. So less bleeding seems to make it better.
And women come in, I got to go, but women come in, when
their
earrings get ripped off and get the earlobes sewn together. Had that college, it
happens. That's fixable.
I'm so glad it is. All right, for more information about Dr. Mele, you can call 925-943-6353. Check him out on the web, drmele.com or sanfranciscobreast.com. Again, the before and after pictures are all there on his website. We'll be right back with lots more on Body Beautiful.